about transient ischemic attacks.
Anyone who's experienced a TIA knows it can be a frightening event for you or the people you're around. And you may be wondering exactly what was happening inside your body when the TIA took place. Let's take a closer look. Blood travels through different pathways in your body, carrying oxygen and nutrients to your brain and nervous system. When one of those pathways becomes blocked by a clot, the brain no longer gets the fuel it needs to work properly. And without the right fuel, your brain might not allow your body to work the way it normally does. So what happens? TIAs present a variety of symptoms, and the symptoms you experience will depend on which area of the brain is affected. But here are a few of the most common ones.
1. Muscle weakness, numbness or tingling.
These symptoms can occur in your face, legs, or arms, usually on one side of your body only. A TIA may cause your mouth to droop on one side, for example, or cause one of your hands to lose its grip.
2. Vision problems.
During a TIA, everything may look blurry or you may have double vision. Sometimes part of your vision is affected, or in some cases you won't be able to see at all.
3. Dizziness.
You may feel unsteady or lightheaded. You may also have trouble walking or trying to stand.
4. Difficulty speaking or understanding speech.
A TIA may cause you to slur your words or have difficulty expressing your thoughts. You might not understand what people are saying to you, almost like they're speaking gibberish.
5. Headaches.
You might also experience a sudden headache that feels like a severe migraine. Now, these symptoms usually last between 30 seconds and 10 minutes, but some may persist for up to 24 hours. But no matter how long the symptoms last, it's important to know that some cells may have been damaged during the TIA. Being without oxygen, even for a short time, can kill brain cells very quickly and potentially cause permanent brain damage. That's why it's crucial to seek immediate medical treatment if you think you've had a TIA. Remember, take immediate action by calling 911 or going to the nearest hospital.
Causes, diagnosis, and treatment.
Now that you understand what to do if you or someone you know experiences the muscle weakness, dizziness, or visual and speech impairments associated with a mini stroke, it's time to understand what causes a TIA, and most importantly, how to treat it and prevent another.
What causes a TIA?
Inside your body is a network of arteries that operates like a highway system to transport oxygen and nutrients to various parts of your body. Sometimes, over a long period of time, dangerous fatty materials or plaque can build up on artery walls. This process is often called hardening of the arteries or atherosclerosis. If a blood clot forms within the plaque, the clot may break away from the artery wall and create a sudden blockage where no blood can get through. The result may be a TIA or a stroke. In a TIA, the clot breaks apart quickly, clearing the artery and allowing blood to flow where it's needed. That's the good news. The bad news is that the plaque still remains within the arteries and could cause another TIA or even a stroke. Certain health factors like high blood pressure, diabetes, and high cholesterol all put you at greater risk of developing plaque in your arteries and of having a TIA.
TIA diagnosis.
We've just spent some time discussing what causes a TIA, but you might be wondering how doctors will know if the symptoms you had are the result of a TIA or something else. Once you arrive at the hospital, your medical team may issue a number of tests. These tests will help them determine the exact causes of your symptoms and the best treatment plan for you to follow. It's important to know that making a clear diagnosis can take time. It's natural to feel anxious as you wait for results to become available, so stay in touch with your physician during the process and continue any prescribed treatment. Some common tests include checking your blood pressure and other vital signs. Blood and urine samples may also be taken. An ECG or electrocardiogram may be done to look at the rhythm of your heart. This can help the doctor determine the possible cause of your TIA. The doctor may also want to assess the health of your blood vessels, so a CT scan of your head or an ultrasound of your heart and neck arteries may be needed. In any case, your medical team will want to order any tests they feel are necessary to assess your overall health and determine the treatment that's right for you.
TIA treatment.
Once your medical team has a better understanding of your specific symptoms, you may be prescribed medications to minimize the risk of having a stroke or another TIA. These medications might include the following.
Medication.
Blood thinners can prevent harmful clots from forming in the heart or blood vessels that supply the brain with much-needed oxygen. Antihypertensives help lower blood pressure and may slow the development of arterial disease. Medication to control your heart rate or rhythm may be required if this is found to be a key cause of your symptoms. Cholesterol is one of the components found in the dangerous plaque that sticks to the artery walls. If you are diagnosed with high cholesterol, lipid-lowering medication can lower your body's cholesterol and reduce the risk of plaque forming within the arteries. In some cases, a surgical procedure may be necessary to restore normal blood flow in arteries to the brain. Remember, it's very important to take the prescribed medications as directed by your physician, even if you're feeling better and even if you don't have any noticeable symptoms.
Lifestyle changes.
Medications are one way to treat the causes of a TIA, but there are other equally important treatments that you can control. Did you know that lifestyle changes may be the most effective way to avoid having another TIA or a catastrophic stroke? They are, and here are some to consider.
Monitor your blood pressure.
Detecting the onset of high blood pressure is crucial to prevent a stroke. Monitor your blood pressure regularly, either at home or at the pharmacy or at the doctor's office.
Stop smoking.
Smoking is one of the biggest contributors to arterial disease. For help quitting, talk to your pharmacist or physician about a smoking reduction strategy that best suits you.
Get active.
Moving your body and exercising your heart is known to improve your overall health and reduce your chances of suffering a life-changing TIA or stroke.
Eat a healthy diet.
Keeping your arteries clear and your heart healthy is connected to what you eat. To improve your diet, try decreasing your fat intake, especially trans fats. Try substituting fish for red meat at mealtime, and always eat a diet rich in fruits and vegetables.
Maintain a healthy weight.
People who are overweight have an increased risk of developing atherosclerosis, the disease that causes artery walls to be coated with dangerous plaque buildup. Consult your doctor for weight loss strategies, or visit a dietitian for guidance in modifying your eating habits.
Limit alcohol.
People who have more than 2 alcoholic beverages a day are at an increased risk of stroke. And for heavy drinkers, the risk of stroke is even greater.
Control other diseases.
Conditions like diabetes or heart disease can make your body more susceptible to having a TIA or a stroke. It's important to keep these conditions stable by taking all prescribed medications and following the instructions of your healthcare team.
Life after a TIA.
We hope this video has helped you understand transient ischemic attacks, or TIAs. Now you know a little more about their symptoms, their causes, and what can be done to treat and prevent them. It's great you're getting educated about this condition because, in the end, you have more control over your health than anyone else. You do. That's why it's essential to be aware of what's happening inside your body, to follow your doctor's instructions, and to ensure you're living a healthy, fulfilling life. And remember our motto, TIA means take immediate action. If you or anyone you know is having the symptoms already discussed, seek medical help right away. And if you've had a TIA and want to lower your risk of having another, talk to your healthcare provider about the recommendations on this DVD. It's important to do something because your health is worth keeping. So thank you for watching. Good luck and good health.
To learn more about TIAs or strokes, contact your local Heart and Stroke Foundation for information on risk factors, lifestyle changes, and treatment options. Many of these resources are available to the public, free of charge.